Here's a tough pill to swallow. Medicine is 20 to 30 years behind for a lot of diseases that we're suffering from. The research shows one thing, but clinical practice is totally different. When it comes to ME/CFS in particular, the latest literature shows abnormalities regarding blood, whether you're looking at the cells or the platelets. However, the standard lab workup is not looking and likely will never look for these things. For one, IgG antibodies in ME seem to cause mitochondria to fragment, ultimately disrupting how cells make energy, leading the body to be in an advanced energy stress state with high AMP levels and a low ATP ratio that a standard panel just wouldn't be able to see. And of course, it's not just in the cells, but blood flow. In that video and that series, I discuss how red blood cell velocity is an issue, meaning your cells struggle to navigate and drop off oxygen where it needs to go. This can cause tissue hypoxia even if everything seems fine. And a third one, just to name a few, is a immune blind spot that medicine doesn't check for. Standard white blood cell count only looks at the number of cells, essentially. It's not looking at their function. Very recent study shows that patients with ME/CFS have a massive defect in their TRMP3 ion channels in their NK cells. Now, what this means for you practically, I'd probably have to do a whole video on it, but this is critical for intercellular communication and signaling. And so normal labs don't mean that you're okay. It just means medicine and insurance haven't caught up to what the science reveals. Some analysis is practical, some is not. But frankly, even in the practical everyday labs, I suspect that if we were to do a deeper study, we would see people with more abnormalities on some routine lab work, possibly in subsets. Now, that's just my thoughts. But however, directly linked to your question with respect to the study on red blood cell velocity, this has not been directly linked to routine labs. So there's no literature around that. However, practically, even as you look through my comments, you'll see a lot of people who report having ME and several of these blood abnormalities on routine labs.